So Corinna, what happens if people use essential oils incorrectly?
Well, first of all, just remember that everyone is different. So one person might get affected by using one oil and somebody else might not have the same effect. But just know that you have to take care and you have to do your research. Make sure that you're reading reputable resources so that you can know exactly everything that you need to know about the essential oils and how to use them properly.
Essential oils, they are distilled from the plant, so they could be as much as 200 times more potent. And this is why diluting the oil is very important. Europe and the United States have very different approaches to safety. What's your approach to using essential oils on children?
Well, our opinion is that children and oils don't mix. Keep it away from the reach of children. They happen to open up a bottle and it spills all over them. Something that is so concentrated on their very delicate skin can burn them very badly. So you need to keep them away. And also the use on the child itself. We don't recommend using it on very young children.
When we're using essential oils, what are some of the key things that we should be aware of?
Well, there are three things. First of all, you have to know what oil you've chosen from what company. The quality that you choose, the oil quality that you choose is extremely important. That's number one. Number two, you have to be aware of the external symptoms that one can experience if using an oil incorrectly. And number three, and probably one of the most important things to be aware of, are the internal symptoms. Because they're hidden away, you can't see them like you would on your skin. The internal symptoms can add up over the years, and then you could end up having very adverse reaction.
So when it comes to the external symptoms, what are some of the examples that you have?
Well, for example, you can get skin irritation. Okay, so irritation can be a reddening of the skin. You can visibly see the skin reddening, it feels hot, it could feel tingly, it feels itchy, those kinds of things. Keep the oils away from the moist membranes. And by moist membranes, we consider such things as the mouth area, that's a moist membrane. Mucous membrane is the other name for it. The eye area is another area to keep away from, absolutely.
And the bikini area?
Of course. So those areas should not be in contact with the essential oils. You can get skin allergies, and by that it's not just an irritation. It could be hives that you can experience. And then the other thing is phototoxicity, which we'll be talking about in another video. But that's a bad reaction that you get when you're using an essential oil, especially a citrus oil, and going outside directly into the sunlight. And then the sun just starts reacting with the oil on your skin and causing an adverse reaction.
And what are some of the internal symptoms that we might be experiencing?
There are a lot. Research is just starting, on that really over the last few years. We don't recommend the use of essential oil with pregnant women. By taking the essential oils and using them, you don't know what effect it might have internally on you. So stay away from that if you're pregnant. The other thing is that some of your vital organs can be affected by the use of certain essential oils, especially the liver. Some cause toxicity to the liver. You need to be aware of that. The other thing too is to keep in mind the fact that certain essential oils react with certain medications that you're taking. For example, there are some oils that are not to be used if you're using blood thinners, or some oils can also cause fluctuations in blood pressure. So you need to be aware of all of these things. So we're just giving you ideas that you need to keep in mind when you are embarking on a journey of using the essential oils.
The last point is on essential oil safety. And here are some questions that you might want to ask yourself when purchasing or using essential oils. So first, is the oil a true natural essential oil, or is it a synthetic fragrant oil? Second, is the oil contaminated? Third, has the oil been stored incorrectly? So remember that the essential oils should be stored in dark colored glass containers in cool places, away from light and air, and with the top tightly on. Lastly, has the oil bottle been opened, and is it old and oxidized? Using an old and oxidized essential oil, it's likely to cause allergic reactions.
Absolutely. And the word oxidized, when you are studying about essential oils or reading up on them, comes up over and over and over again. Oxidation is just purely a reaction between a substance and oxygen, but it is a chemical reaction, so the substance that you're getting is different from the original one. And that being the case, the effect on your body can be very different than what the oil was intended to help with. So you need to make sure that the bottle of oil that you are using is not oxidized.
Right. So how can you tell if an oil is oxidized, and what are some of the main factors that we should be watching out for?
Luckily, it's easy to tell. For example, a lot of essential oils have a wonderful fragrance to them. If you're opening up the bottle that you have at home and the fragrance has changed in any way, if it just smells different than when you first bought it, then you know that the oxidation has begun. And then I would definitely recommend not using the oil and purchasing a new one. The other thing is that not all essential oils have an expiry date on them. Some do. Okay, so check for that. But if they don't, there are guidelines that indicate how long you should be keeping an essential oil. But if you are keeping it for any extended period of time, just like you were saying, it has to be kept in a dark, cool place. You can keep it in the refrigerator, definitely. That will slow down the oxidation process. The moment that you take the lid off of the essential oil, oxygen goes into the bottle and the reactions start. So if you're using an oil over and over again and you're taking the lid off and on, okay, more oxygen gets in there, more oxidation will take place. So you have to know, is this an oil that I'm using often sometimes, but then leaving it alone for others and then going back to it after a month or two, well, oxidation might have taken place. You can also look and to see if the oil has changed visibly. So it's hard to tell in a dark bottle, but when you're looking at it, if it has a dropper or whatever, you're taking the drops out and the oil is not the original color, it is cloudy, oxidation has taken place. Also, sometimes if you're looking at the bottom of the bottle of oil and you'll see some residue, a sediment, that is due to oxidation. That can also be the case if you've mixed, let's say, essential oil with a carrier oil and you've made a blend that you're using. The oil in the blend itself can be oxidized. So it's not just in the original bottle. So those are all clues that you need to purchase a new essential oil bottle.
I also want to add that if you are using essential oil from a big bottle, and then you're halfway through or almost done, then you might want to transfer the oil into a smaller container so that it reduces the contact with oxygen in the bottle, so it will prolong the life of that oil.
Actually, we're going to be talking about that in a future video, because the space that's left at the top of the bottle, like you're saying, excellent point, is oxygen, isn't it? So, I mean, it's not pure oxygen because it's the air that we breathe, but a component of it is. And so, therefore, there's always that reaction that takes place.
Right.
Great. Yeah.
All this may sound overwhelming, and it's not in any way to discourage the use of essential oils. We would not think twice about learning all we can about a new medication prescribed to us by a family doctor or any side effects that it may cause. So the same can be expected with the use of essential oils, as long as we are taking, cautionary steps and we consult professionals. There should not be any problems when using essential oils.
And actually, it's always surprised me, Lily, because if you go to the family doctor and they prescribe blood pressure medication or whatever, sometimes you go home without the prescription, or you take the prescription but you don't fill it because you want to do your research. Everybody does that. Sometimes you go for a second opinion. Well, essential oils are powerful chemicals as well, so people need to take that time to research before they start just embarking on a journey of taking on essential oil remedies that they think might help, because you wouldn't do that with regular medication, nor should you do it with essential oils. Always check with your family doctor if you're experiencing health issues, and do not try to self-heal. When dealing with elderly, the dilutions that you should be using, because their skin is so thin and very delicate, it should be half the amount that you would use on an adult. And also not to use essential oil on someone who has a diagnosed respiratory disease, and some essential oils can react with some prescribed medications that you are already taking.
So lastly, if you do encounter any adverse reactions, then you have to do these steps immediately. First of all, wash the oil off of your skin gently and keep the affected area exposed to the air but away from the sun. And lastly, seek medical attention immediately.
A lot to remember, a lot to digest. Very important information. We will be covering some more about safety later on, but just make sure that you do use essential oils with respect. So hope that you enjoyed this video.
And please subscribe to our channel.
See you later.
See you.
Bye.